So we're going to talk about imaging to assess the relationship between stress and stress perception and cardiovascular disease events. We're obviously quite impressed with the relationship between stress and CVD events, and also impressed with the need to do studies to better understand the mechanism that relate those two. It's not exactly clear how they're related, but animal models suggest that there might be a link between stress and subsequent activation of the bone marrow and the arterial inflammation. So we wanted to see if an analogous system were present in humans as well. We studied 293 individuals who had PET-CT imaging and had follow-up of their cardiovascular disease events for about 4.5 years. And around that time, we were able to see that there's a link between the degree to which the amygdala, a portion of the brain that is receptive to fear, lights up or takes up fluorodeoxyglucose, and the subsequent development of CVD events. What we saw was that there is a portion of the brain that actually, when it's active, is associated with more heart disease events. The other thing that we saw was that there was a link between that amygdalar activity and the amount of metabolic activity within the bone marrow and the amount of arterial inflammation that we saw in vessels. So the way we selected our patients were basically individuals who were coming in for cancer screening. So first, we excluded individuals who were found to have active cancer. Second, we also excluded individuals with known cardiovascular disease at baseline. So we wanted to look at incident cardiovascular disease events in this particular population. The other thing we did is we had coronary calcium scores on these individuals and found that the relationship between the amygdalar activity and cardiovascular disease events was strong regardless of the amount of pre-existing atherosclerosis based on coronary calcium scoring. They give us some insights into mechanism. First, that there is a portion of the brain that when it's metabolically active has some information around downstream risk for cardiovascular disease, and that's novel. And the mechanism there was that when we did mediation analysis to look at the intermediary tissues that might relate to the amygdala and CVD, we find that the bone marrow activity and arterial inflammation seem to account for the majority of the relationship between amygdala and cardiovascular disease events. So what's that tell us? It tells us that there seems to be an analogous system to what's been described in mice, for example. And it also gives us, therefore, some opportunities to try to interrupt aspects of that system. In mice, you can give beta-3 adrenergic antagonist and reduce the amount of bone marrow activation that results from stress. In mice, they also do splenectomies. Don't think that that has durable benefits, but that also reduces the manifestations of stress in terms of arterial inflammation. So you can see there are several aspects in addition to modulating stress in the first place. Our observations tell us something about a relationship. It doesn't really tell us about causality. We don't know the directions that these relationships play. We don't know if these are bystander effects. So doing prospective studies to see if you could interrupt parts of these could help get to the aspect of causality. But then the fun begins, really. If you could find a way to interrupt this, and there are several ways. First, the hardest thing is to reduce exposure to stress. Obviously, I would love to find a way to package that approach. But the second thing would be to modulate the response to stress. Obviously, people have very different ways of responding to the same stressor. You have individuals who are quite resilient and people less so. And so better ways to understand how to develop resilience. And there are some resilience training approaches that are effective in promoting resilience. So the question would be, would those approaches result in benefits downstream in terms of less bone marrow activity, less arterial inflammation, and less CVD? That bears some future study. And interestingly enough, very recently, a paper came out from a group at Duke where they looked at patients who had a recent myocardial infarction, and they looked at downstream events, recurrent myocardial infarctions, and found that the individuals who had coping training in addition to their standard treatment actually had a substantial reduction in future CVD events. So thus far, there's an emerging literature to suggest that some of these resilience training approaches might have benefits. Whether that's applicable to chronic stress is unknown. Chronic stress in patients without atherosclerosis, without CVD events, Then the other downstream treatments are things that are worth considering. Could the same beta-3 adrenergic therapeutics that have been used in the animal models, or similar ones, be effective in reducing the downstream effects of stress? That's something that could be investigated in the future as well, and maybe ways to modulate the impact of the monocytes that are produced by the bone marrow as a result of stress would be another thing that would be very interesting to look at. There were a few surprises. First, that the relationship was robust as it was frankly surprising, and it needs to be re-explored in a perspective in larger study. So that's one surprise. We also had a little bit of an unexpected relationship to family history of prior coronary disease, and that bears further exploration as well.